it's Corinne again. So welcome to real episode 1 where there will actually be science. And I am going to teach you easy to understand facts about COVID-19. So check out the introduction video, episode 0, I guess, to get a gist of what this series is going to be like. A friendly reminder before we get started, I am not a healthcare provider. I'm just a science teacher. So if you do have medical questions or concerns, please go talk to your doctor or your nurse or your healthcare provider. So today we're going to start at the beginning. What exactly is a coronavirus? What exactly is COVID-19? So if you look here, I have lots of notes. I'm going to link all of the sources that I used in the notes or down below or whatever if you want to do any more research on your own or if you want to read up a little bit more. So to start off, what is a coronavirus? So coronaviruses are named because they have spikes that come off of their body and it kind of looks like a crown. So those are the little spike proteins, which we call a coronavirus. Coronaviruses, shortened as COV, they infect a bunch of mammals, a bunch of birds. They can cause a range of diseases from respiratory tract infection, so your lungs, your gastrointestinal tract infection, so your stomach, and also your central nervous system. So there are a lot of common coronaviruses, and chances are you have been infected by one if you've had, the common cold or if you've had a respiratory infection before that may have been caused by a common coronavirus. They're just a virus. We also have the big scary ones that we've heard about on the news before, and those are going to be the MERS-CoV. So the MERS coronavirus, that is the one that causes MERS, or Middle East Respiratory Syndrome. We have SARS-CoV, so that coronavirus causes SARS, which is Severe Acute Respiratory Syndrome. And then we also have SARS-CoV-2. So this is the new coronavirus that was just discovered, which causes COVID-19, which is Coronavirus Disease 2019. So COVID-19 itself, so that is the illness that is caused by the virus, which can be spread from person to person. So when you look at the name COVID-19, so you have the CO, that's for corona, the VI is for virus, D is disease, and the 19 is because it was discovered in 2019. So that's what COVID-19 actually stands for. It's the disease caused by this specific coronavirus. So how exactly is it spread? How can you get this? How can you give it to someone else? So generally, you can become infected by coming in close contact, and we consider that, about 6 feet or easier to think 2 arm lengths with a person who has COVID-19. And it is generally spread from person to person. I know the news says it's mostly person to person, not porcelain to person. So you're more likely to get it from another person, not from a surface. So COVID-19 spreads primarily through droplets of saliva or from discharge from your nose. So if you have a runny nose, that can be spread through coughing or sneezing. So it's, important to practice your social distance. So stay far away from people. And if you do have to cough or sneeze, go in to the elbow. So you can become infected from those respiratory droplets. So when someone coughs or sneezes or breathes even in that distance, in that 6 feet. You can also get it by touching a surface or an object that has the virus on it, and then by touching your mouth or nose or eyes. That is less common. So it's mostly by people, not by porcelain. What are the symptoms? So most people that are infected by COVID-19 will generally experience mild to moderate respiratory illness, and you will recover with no special treatment. You don't have to go to the hospital. You don't need a ventilator. However, if you are older, if you have an underlying medical condition such as cardiovascular disease, diabetes, chronic respiratory disease, and cancer, as well as others, you are more likely to develop a serious illness. Some people might not even notice that they're sick. You might get infected, but you have no symptoms. So we call these asymptomatic cases. You are sick, but you are without symptoms. But the problem is, even if you don't have symptoms, while you are infected, you can spread it to other people. So even though you don't know you're sick, you are spreading it to other people. So think of like Typhoid Mary. If you don't know about Typhoid Mary, look it up. It's really cool. Well, not cool, but unfortunate. She was sick. She was giving everybody typhoid, and she never even knew that she was sick. On average, it takes 5 to 6 days from when someone is infected with the virus for symptoms to show. So you can be sick for about 5 to 6 days without experiencing any symptoms, but it can take up to 14 days. So you might be sick with COVID-19 and not get symptoms until like day 12. So it differs from person to person. COVID-19 affects people differently in different ways. Again, most infected people will develop mild to moderate illness and recover without hospitalization. So the most common symptoms are going to be fever, a dry cough, and tiredness. Some less common symptoms are aches and pains, sore throat, diarrhea, conjunctivitis, so pink eye, headache, loss of taste or smell, and also a skin rash. So you can have discoloration of your fingers or toes, as well as a rash on your body. The more serious symptoms are going to be difficulty breathing or shortness of breath, chest pain or pressure, as well as loss of speech or movement. Now, the real problem with this is it's possible for people to spread the virus about 2 days before experiencing any signs or symptoms. And you can remain contagious for about 10 days after those signs or symptoms first appear. So what can happen is even before you know you're sick, just like asymptomatic people, you can be spreading COVID-19 from person to person and not realize that you're doing so. So that's one of the main concerns of this disease. Now, in general, a lot of people are comparing this to the flu. So is it just the worst flu? Are they the same thing? And some of the symptoms are very similar. However, COVID-19 seems to be spread more easily than the flu, and it causes more serious illness in some people. And again, it can take longer for people to show symptoms, and people can be contagious for longer. So you are more likely to spread COVID-19. In general, if we're also looking at the death rates between COVID-19 and the flu, so I have stats for you. So from COVID-19, there have been approximately 2,193,577 deaths reported worldwide. In the United States, 433,213 people have died of COVID-19 between January 2020 and January 29th, 2021. So a couple weeks ago. The flu, the World Health Organization, estimates that 290,000 to 650,000 people die of flu-related causes every year worldwide. So doctors and scientists have done estimations that the mortality rate of COVID-19 is approximately, based on the best records, about 10 times more dangerous, more deadly than most strains of the flu. So it is worse than the flu. Another misconception that we have is it that bad, or is the news just hyping it up? So generally, older people and people with serious medical conditions are more likely to experience these lingering, long-lasting COVID-19 symptoms. But even if you are young and healthy, you can still feel sick or have symptoms for weeks after your infection. So some of the most common lingering side effects or symptoms are fatigue, shortness of breath, cough, joint pain, and chest pain. You could also have muscle pain, headache, rapid heartbeat, loss of taste or smell, memory and sleep problems, and hair loss even. So these can be around for months to weeks, or weeks to months after you are infected. They did a study in Rome that showed 87% of patients that were in a hospital had at least one symptom nearly 2 months later, and more than half still had fatigue. So this isn't just, you get it for 2 weeks and you're fine. You can have these long-lasting symptoms that just don't go away. And most importantly, doctors have found no link between the severity of your COVID-19 case to these lingering symptoms. So even if you have a mild case, you can still have these symptoms for months afterwards. Other serious long-term damage, there can be organ damage. You can have long-term damage to your heart, lungs, and brain. There are known blood clots and blood vessel problems. So you are more likely to have blood clots. And they found that people even as young as 30 are experiencing strokes after being infected from COVID-19. So even if they had mild symptoms, they were developing strokes in their 30s. There have been problems with mood and fatigue afterwards. So even like unrelated to the symptoms of COVID-19, if you are, treated in the hospital and you have to go through a ventilator or all of these, struggling symptoms, you're going to have, stress and anxiety and the potential to have depression afterwards. And I think the real concern is most of the long-term effects are still unknown. This is a very new disease. While scientists and researchers are learning as much as they can, we still don't know. We don't know the long-term effects. It's important to remember that most people who have COVID-19 will recover quickly. But there are potentially long-lasting problems from COVID-19 that make it even more important that we reduce the spread. So using the precautions that we know. So wear a mask, avoiding crowds, and wash your hands. And I think big picture in general, think about the strain on the hospital systems right now. So in November, hospitals in 25 states, so half of the country, reported staffing shortages because there were either not enough nurses or doctors to care for the number of patients, either because A, there were too many patients being admitted, or B, the healthcare staff was getting sick and infected themselves and they had to stay home. There was a report that showed that hospital admissions are decreasing across the country, which sounds good. You're like, oh, there's less people being admitted to the hospital. That's actually bad because as hospitals are being overwhelmed, there's too many people in the hospital. They're admitting less people just because they say we need to keep space available just in case. So that means that some people with less severe COVID cases or some people with chest pain or general infection or other less severe problems, they're just being asked to go home and manage it themselves. And actually, the Journal of American Medical Association Cardiology did a study where people were twice as likely to die from a heart attack during the pandemic because they are ignoring their systems because they don't want to go to the hospital. So I know that this was a lot of information, a lot of stats, and a lot of doom and gloom, but I don't want to use this to scare you. I just want you to realize that this is a problem and this is serious. And this is why people should take it seriously. So moving forward, it's going to be a lot of so what can we do to fix it? Next week, I might talk more about the new variants, the new different strains that are being found and being spread. We'll see where that fits in. But in general, I want to talk about preventions and treatments. So using masks, using social distancing, and then a lot of this is going to be about the vaccine. So talking about the vaccine, like how they work, are they effective, like which one is best, and in general, like the vaccine itself, the science behind it is super cool. So I'm excited to talk about it. If you have any questions, suggestions, comments, concerns, or anything else, I would love to hear from you. So that way I can do more with future episodes. But other than that, thank you for watching, and I will see you next time. Bye-bye.